You care? You really care? No, really, I'm impressed. The women I spoke with genuinely want to help other women and girls, especially around sex. Hi, I'm Dr. Mo, your host of The Basics with Dr. Mo. Sure, it's important to learn about pregnancy prevention. There is nothing glamorous about being a mom before you want to be. Anything you want to know?
Young women, from being a kid, I think sex education is very, very important.
How sex functions, what sex is.
The lack of real sex education in school, information from porn, mainstream media, it can be just wrong.
Definitely like their vagina and how during puberty, how it all works. Like there's so many questions growing up that I had that I didn't really have anyone to speak about. Like it's the worst when you're lost at like 13, getting your first period, not knowing how to go about certain things.
But what about the vagina? Pornography may not provide accurate or relevant information on this topic. Right now, pornography is a primary source of sex education for boys and for girls. If you want more detail, check out Scarletine, Sex Ed for the Real World. Maybe it can help the young women and girls in your life who have questions that you can't answer.
There's a lot to be known about safe sex, education on STDs and stuff, because people, I think, are more focused on like being scared about getting pregnant, and which is also a huge concern. But STDs, like some people don't realize, especially college students, that like some aren't curable.
STDs, STIs, those kinds of things, yeah. When it's easy to catch UTIs, the bacterial infections, STDs, all those type of things is very important for women to know about, because especially since a lot of women don't know that, especially after oral sex, you should pee, just to, a lot of people don't know that. So I feel like they should know about the things you should do after.
Well, look at that. Our old friend, the sexually transmitted infection, rears its ugly head again. I have two things to say about that: February and October. According to the Centers for Disease Control and Prevention, these are the 2 months with the biggest spikes in the number of sexually transmitted infection cases among college students. That translates to roughly 2 to 4 weeks after the semester begins. Enough said. A lot of this is Sex Ed 101. Can we go any deeper? Yes, we can.
Deciding when to have sex with someone and like how to say no, how to like have it be consensual, and like how to know if you want to have sex with someone or not.
I think young women right now don't really know about they don't really feel comfortable discussing things. I think people have a strange idea of what is normal and what other people are doing their age that might not be always correct.
I think they should learn more about like how to have good sex and how sex works, because all we really learn is like how to have safe sex, how to just put a condom on and then do it, but no one really understands like how to have sex that's like, it doesn't hurt, or like it's, feels good for like the girl too.
Now that's what I call sexual health beyond the basics: pleasure. You may not know this, but there's a lot of science out there about women's pleasure. There's a website that pulls it all together. OMG, yes. Let me say that again, OMGYES.com. As always, I want to give a huge thank you to all of the women who share their stories. We couldn't do this without you. Don't forget to subscribe, follow, and share The Basics with Dr. Mo, because you deserve to know. Thanks for watching.
Oh man, all right.